Hi, it's Diane again from Allied Health Career Training, and I'm here in Kingman at Wheatlands Healthcare Center, one of the premier culture change, person-centered care homes in the state, and I'm talking with a real professional, a veteran, when it comes to administering medications to those of our elders with dementia. And I have Sharon here with me, and we're going to visit about giving medications to those, especially those with dementia. So Sharon, you've been at this quite a while.
Yes.
And you work in the Alzheimer unit here, right?
Right.
And tell me just some of the different kind of people, the type that you see here, and some of the challenges of working with those, and the blessings, I suppose, of working with folks with dementia, and how it might be a little bit different passing meds to them.
Okay. I have to probably say the first thing is that you can't really say that you have a schedule. You go on their schedule. And, you know, because if you've woken them up or something and they're in a bad mood, they're not going to take their medicine. So you have to go and approach them as to what their mood is like and so forth. And each one's a little bit different.
Real individualized care.
Yes, right. Very individualized. And you have to obviously have a lot of patience, and you just approach it like it's the first time you've ever given them meds, because a lot of them are going to ask you, you know, what is this for? I don't take this. Who ordered this? And things like that. And so, you know, you just, sometimes you even have to get the MAR out and say your doctor's ordered this and that. But that happens quite frequently. And
even if they've been on it
right,
for months.
Right, or even years.
Or even years.
Yes, that's probably, and like I said, it happens a lot. So you have to just approach it like it's the first time, you know, and
go with their flow.
Yeah, go with it and tell them. And I tell them what the drug is and what it's for. You know, just level with them. You know, just there's a lot of times you have to know when to back off. Too. It's like if I can't get them to take it after a couple of times, I'm going to go and I'm going to try a little bit later. Sometimes you have to actually get a new person, fresh approach. And sometimes it's a different environment. Sometimes they don't like to take medicine in the dining room, but if you go in their room with one-on-one and just talk to them a little bit, then you can get them to take it. But each one, as you said, is individualized, and it varies from day to day.
Do you ever have situations where, let's say you're going to give them a med and they say, oh, I don't have that disease. For instance, a high blood pressure medication that's obviously very important. And they say, well, why would I take that? I don't have high blood pressure.
Happens a lot. And you tell them that they do, but it helps to show them too, even though they have dementia. If you just kind of sit down and talk with them, it makes them feel better. I get that a lot with pain medicine too. Well, I'm not having pain. Well, because you've been taking this and it's controlling your pain. We want to give it to you to keep your pain under control, because it's much easier. But you know, that happens probably on a daily basis, and a lot of times I don't have any pain, I don't need this. And that's
so I suppose there'd be difficult to really there's a balance somewhere in there between they have a right to refuse and walking down that path and taking the time to explain it to them so they understand.
Right. Just like I said, it's patience. And it's approaching, even though it may be the 100th time you've said it, even that day, to them it's the first time.
So when you walk up, when you approach the person, what are some things you have to be careful of?
You don't want to scare them. You want to, get in their sight. And I try to actually maybe pull up a chair or something so that I'm not looking down at them. I pull up a chair and sit alongside with them, you know, and just
eye level.
do a little bit of small talk. Yeah, I never like to
Small talk.
Yeah, I never like to just stand over them, you know, because that's going to intimidate them. So pull up a chair, join them, and that helps a lot.
So it sounds like you're less task-oriented and more person-oriented.
Right.
You sure can't be in too much of a hurry, could you?
No.
That probably doesn't play
And that's
real
a
well.
big clue too. You learn the ones that do take a little bit longer, and I always save those for last because I do spend time with. I never rush any of them, and if you rush, you're not going to get it down them. So you learn, and you just, like I said, the ones that take longer, I save them for last so that I can spend time with them just as much as I do with the ones that don't.
So it's going to take a long time one way or the other.
Right.
Whether you do it on the front end or the back end, probably better just to approach it with that in mind, that it's going to take a while.
Right. Yeah. And always tell them what you're doing. Don't just shove a spoon in their face, you know. You just sit down, like I said, just sit down with them a little bit, and I have your medicine here. Then what's it for? So tell them what it's for.
A little bit of chit-chat goes a long way.
And like I said, really staying on their level, you know, not looking down on them or anything that might scare or intimidate them.
Do you find that some of them almost, when it comes, we have to be careful not to have them feel like we're too much of an authority figure as they, do some of them get intimidated, and others, I would imagine, might feel like, who are you to come, you know?
Yes.
Do you find that more with men or not so much?
Not so much. Of course, there's more women in the, you know, back here a bit. It happens to either. And actually probably more with women because I have more women. But, you know, you just have to take the calm approach, as I said. And I said every time you say something to them, it's the first time. It's the first time for them. So just lots and lots of patience.
What would you do if you had, let's say they take 5 or 6 regular meds and doc ordered a new one? Integrating that new pill.
I actually tell them that I point it out to them, and I never assume that they, just because they have dementia, that they don't. And I point it out to them and say the doctor, you know, like an antibiotic or something, and I tell them what it's for. I still, honesty is still the best policy, no matter if they're demented or not. You just tell them, and most of the time, okay, you know, they're fine with it.
Okay. What are some of the biggest problems you find when trying to administer medications to those that are confused, that are really struggling?
That they don't want to take it, that their doctor hasn't ordered it, and there's just times when you're not going to get it down them, and you know you have to put refuse. But more often than not, if you just put it up and try a little bit later, just a fresh approach. And if for some reason they're not liking the person giving them their meds or something, then you have somebody else try. Because that's a new face.
Or a new surrounding, or a new anything.
Yeah, exactly. Because like I said, sometimes they won't take it in their dining room, but if I go in their room and sit with them on their bed or something, they'll take it.
Okay. Sounds like some good information. Anything else you want to add to this?
No, just take your time and be patient, and you learn, like I said, you just treat each one as an individual.
No shortcut.
That's right. Don't ever rush, because they can sense it. So it's like, don't ever rush.
No matter what's going on, just take a deep breath.
Right. Don't rush, and don't stick a spoon in your mouth. Here's your medicine. You get on their level, you take your time, you tell them what you're doing.
Now, by the time they get back here, I would imagine they're pretty far into the disease process?
Most of them. Not all, but most. Yeah. So, and that's, of course, when you have to mix the medicine with food. We're finding out right now, actually, the best way to administer medicine, believe it or not, is with chocolate syrup. You know, they used to do yogurt and applesauce, but at least back here for our people, the chocolate syrup is just a little dab, you know, and it's working very well.
Wow.
So
I would imagine that might just mask the taste
yeah,
better than yogurt or something.
Yeah, because they did yogurt for a long time, you know. There's a few, you know, that like it in like a kind of like an ice cream shake or something like that. But there again, you learn what they like to mix it in and so forth. So
Boy, wouldn't you hate to work agency trying to figure all that out?
Yeah.
There's so much to be said for knowing your residents.
that's the key thing, knowing them and not rushing them.
Yes.
Exactly.
Okay. Well, thank you so much, Sharon. You've been a great help.
Thank you.